So welcome everybody. This is the webinar for Medicare Part B of A. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter. Today, again, I'm joined by Leanne Foster. She's going to monitor that chat, try to handle those technical questions. I'm joined by another colleague, Mary Muko. You may hear her help me out with answers, or she may have something to input. So I want to offer I want to make you aware that this may happen in case you hear one of them start talking. All right. A couple people did ask why we were doing this in particular. And again, this is part of our Medicare series. I know I didn't label it new to Medicare, but it is part of that series. When we put this information together, what I didn't realize is how many newer questions we would get. So I will explain what Medicare Part B of A is, and I will go through that. But later in the year, we're going to do a what is Medicare, what is Part A, what is Part B, what is Part C, and what is Part D, and we're going to offer those in Encore available also. So this is part of the New to Medicare series, but we're going to step back a minute there, realizing that we didn't cover that information, and that's where some of the questions came from. And those will be later, maybe starting August to the end of the year. We'll see which month we actually get those scheduled for. But I just want everyone to be aware of that. All right, of course, I got to give you a little disclaimer. This information was current at the time that we wrote it. For anyone who's been dealing with Medicare, you know that Medicare does change. So the Center for Medicare and Medicaid Services website contains the most current information. What's great about the information we're presenting today is that it is high level, it is basic, and it is new, so it really hasn't changed in quite a while. I did prepare responses to questions, and they're based on the facts that were given. Some of the questions I actually can't respond to, and I'll tell you those as well. And that's because I don't have enough information. So when I tell you that, I'm going to ask you to put something in the chat to help me out get further. There are various points where we will stop and take questions. It becomes key with new to Medicare education to give the option multiple times for you to ask those questions. So if you do have a question, put it in the chat right away. Don't wait and don't hold on to it. And I will answer that as we go through. One other thing that we just want you to be aware of is that CMS does prohibit the recording of this presentation. We will record it ourselves. I told you guys I'm recording it, so we've already started that. What we'll do is take that recording and load it to our YouTube channel. And on our YouTube channel, we have an Encore playlist. It'll be there. It'll also be in something called the New to Medicare playlist. So it's going to be in a couple of different places. But it'll give you the opportunity for the next 60 to 90 days, and it's really dependent upon when we get it posted and how long. We do have 30 days to get it to our website. It will also link directly from our website, and we'll have the PowerPoint available on our website. That's what I wanted you guys to be aware of there. So what are we going to talk about when it comes to Medicare B of A? First, I want you to understand that these questions are part of a bigger series. We have done some different parts, and so these came from the new to Medicare portions we've already done. So there are a variety of different items out there. We are anticipating an 8-part series. As I explained, more of them to come later this year, but remaining after the 8-part series. So we want to make sure we're going to hit everything together and get it all put into one and get everything. So our goal is to get you to understand what B of A is, because it affects the systems that you look at, the systems that you use to determine eligibility, to determine whether or not you should be appending certain modifiers. Also, it is a difference from a coverage to a processing. So we're going to talk a little bit about that. And that's what we're going to do to define it. I'm also then going to share with you the systems that are affected and the items that are affected. And then I'm going to go with what it affects you. As a provider, you come in, or as a provider representative, you need to know, okay, how does this affect me directly, and why is this even important? So that's what our goal is. The first thing we did was to build in some definitions. I want to tell you that one of the basic definitions that we will start with is, what is the difference between Medicare Part A and Part B, and how does this affect us as an organization? That is a direct question that was submitted in the pre-submitted questions, or the opportunity when you did the registration. So really, I divined this content to meet all of those different types of questions, and that's where it comes from. So again, the first component is to start off with defining certain things. The first thing we need to do is define the benefits, because the benefits are actually defined in the Social Security Act in Title 18. So it's not as though we as a contractor define these benefits. They are actually coming from a federal law. Now, sometimes you'll hear me say the Act. It's just in reference to the Social Security Act. And again, that is Title 18. Okay? So we'll get through some different things. The easiest way I find, if you want to look up the Social Security Act, Google it. brings it up much faster. Yes, there are links later on. We'll get you some of those different things, but I do find that it's easiest if you're just thinking about it. You're like, where is this at? Look up the Social Security Act, and always Medicare's Title 18. Let's go ahead and drop down a second here. Here is the actual link that I was talking about, and it's just available to you. So if you select it, it'll open it up or not. So you're going to think about it, and it's just going to open our website up. So that's all I wanted to show you, is that this is linked out there. I do have a couple people that have given me comments on my surveys about not giving you the links. They're there. They're just might not be what you're looking for. It might not be this URL. It might actually just be a link like that. So let's talk about what Part A is versus what Part B is. Let's get started with this. So Part A versus Part B are benefit categories. They're how Medicare defines what they pay for versus processing systems or anything else. So Part A and Part B. Medicare Part A is defined as Medicare Hospital Insurance. This is also referred to as HI. This comes from the Social Security Act. Please note, I do know this bracket is wrong. This is actually quoted. And so when CMS did this, I put it on here this way. I'm like, I probably should correct it, but I left it because it's how it is. And then again, this is defined in Section 1811. So Section 18 is the main one, which is what's down here in Title 18, and the section is 1811. So again, Title 18, Section 1811, and that's where we get this. When we look at this information, which is underneath here, it will go through all of the information about hospital insurance. Now, I want to remind you that when we say hospital insurance, the benefit coverage is greater than just hospitals, and we're going to talk about that. Medicare also then has Part B. Medicare Part B is what they refer to as Medicare medical insurance or Medicare supplemental medical insurance. That is how it's defined. What does that mean? Basically, anything that is not inpatient or is not hospital-based. Keep in mind, inpatient and is the key thing there, and we'll talk a little bit more about that because there are outpatient benefits. They're going to be paid under Medicare Part B. This is important because Medicare uses money to do that, and it's two different trust funds. It's two different separate funds that people pay into through taxes, through premiums, and a variety of other things. So it's important to understand that. Now, I will get more into Medicare Part A and B later on. So if you're interested, check out those at the end of the year, but keep watching to register for those. So basically Part A and Part B. The next question was, what is covered under Part A versus Part B? So I put this slide in to help you out. In that manner, I wanted to make sure I didn't leave you out there. So Part A benefits, these are inpatient care benefits. So while Medicare does call this hospital insurance, and what I did is just copied what they would give the patient. This is from the Medicare and You guidebook. This is an exact copy of what they're going to see. So it's called hospital insurance. But does hospital insurance simply cover a hospital? And the answer is no. Also, remember, skilled nursing facilities would fall under this. And then home health and hospice fall underneath this set of money. Home health can occur inpatient, but hospice can occur inpatient, but home health never will. Now, I say can occur because hospice can also occur outpatient. You can do hospice care at a person's home. When that happens, it's still a Part A benefit though. So we want to make sure we're aware of what that means. So though Medicare will refer to Part A as hospital insurance, it does not refer to that. The first item you have to remember is it does refer always to inpatient care. Hospital alone isn't enough because hospitals have outpatient departments, have emergency room departments, have observation departments. These are not going to fall under the inpatient care Part A benefit. Okay. Now, someone did ask me, when you say hospital, am I simply talking about what I would know as an acute care hospital or what I would know as my local hospital? So Medicare does use hospital in a much bigger spectrum. Medicare uses hospital to stand for those acute care hospitals or those hospitals that treat patients. They also include those small rural community hospitals, such as critical access hospitals. Again, by definition, they have to meet this criteria. And they have to be in a certain area range where there's no other facilities around. That's what a critical access is. But along with that, they'll include things like long-term care hospitals, inpatient psychiatric facility, inpatient rehabilitation facility, religious non-medical healthcare institutions, and then some other technical services while they're inpatient. So let's say that they go for an X-ray or they go for an MRI. That service would actually, that technical component would actually be incorporated while that patient remains inpatient. So I wanted to make sure that you're very clear on that. Again, if you have questions, please feel free to put that into the chat and we'll move on from there. Examples, oops, I'm sorry, just went through this slide. I do apologize. These are just some examples of what Medicare would cover under that term hospital. So I just read through this one and I did not move on. Let's move on then and leave Part A, but we're going to move to Part B. Now, once again, I had a very specific question. What is Part B and what does it cover? So remember, I'm talking about Part B benefits, not Part B claims processing. And we'll talk about the difference in a little while because that's going to be part of this. Right now, we're focusing on the benefits. So everything other than inpatient is how I like to call it. That's why they use the term supplemental in the Social Security Act, inpatient and supplemental insurance. That's how it's defined. So when they tell the patient, they call it medical insurance. And then they do give them a list. It's all professional services can independently bill. So let's talk about that for one moment. If you have a registered nurse, that services can be part of the inpatient care. So they don't actually get to separately bill for their service. Now they could bill under a different professional, and that's a different set of categories, and that one would be. But a doctor themselves is always going to be a Part B benefit. It's a professional service. We're not paying them to have a facility. Now we do incorporate some different items into that. Also, any outpatient care. This is the key one that people get messed up with because they hear hospital insurance and they think, oh, Part A. But remember, it's inpatient care, so outpatient care. So when we look at outpatient care, that is a Part B benefit. And I'll explain more about how B of A works and why that's important to understand. Supplier services, ambulance, lab, those are suppliers for Medicare. Durable medical equipment is another supplier. So other medical services not covered by Part A is how they deem it. And then they say, well, they have to be reasonable and necessary. So it has to be medically necessary. This means that in order to treat the patient today, we want to have it medically necessary. And then it has to be reasonable to treat the patient today. Is it going to help the patient? Do we have some other reason? Please note, Medicare preventive services are always a Part B benefit as well. And those are listed out there as well. If you're interested in any of those, you can take a look at that. So that's Part A versus Part B. Hopefully I've answered those two questions well enough. Here is the example that answers, what it does Part B cover. Part B covers ambulance, covers ambulatory surgery, drugs, durable medical equipment. I'm not going to read this whole thing to you, but I wanted you to be aware of and to have this at your fingertips. So Part B is a much broader spectrum. Key thing to keep in mind, anything outpatient would be Part B. So even outpatient hospital, such as observation care, that's still a Part B benefit, though not paid through the Part B systems. And we'll talk about that a little bit more as we get going on to the next slide. So then Medicare says, okay, we're going to give you two claims processing systems. But we're going to divide this isn't by the benefit categories. We're going to set those aside. What we're going to do is use the claim forms that are submitted and the HIPAA standard electronic transactions that are submitted to submit these claims. So in the processing systems, they say there's one called the Physical Intermediary Standard System, or FIS. This are for any claim submitted on a UB04 to Medicare or the 837I electronic transaction. So it doesn't matter what the service is, it's how you submit the claim. Okay? Then we also have the MCS, or the multi-carrier systems. The multi-carrier system looks at 1,500 claim forms and 837P. Sorry, I just realized there's a typo. Cross off I right there and put P, professional transactions. So how do you submit your claim? So when we talk about benefits, it's A or B. How is it paid? Which money does it come out of? The A trust fund or the B trust fund? When we talk about processing, it does not look at it from A and B. It looks at it from claim form submission. This means that the Part A processing system, or FIS, it actually processes both A and B services because it is all hospital services, regardless of inpatient or outpatient. It processes things like home health care. Well, home health care is always done outpatient, right? By definition, has to be done that way under a home health plan of care. So when we look at it, it's how you submit. That's how our processing system works. The Part B processing system, a lot of people call it, it's MCS. This one only processes a Part B service. because only Part B services are submitted on these two types of claims, whether it's a paper claim or an electronic claim. One question I had is, can I actually submit based on paper alone? And the answer is, I can't answer that for you without knowing your provider status as a small provider, because there is a separate federal law that covers small providers and allows for them to submit on paper. There are also times within that law that says, if this is happening, we can do this, and if this is happening, we do that. So it doesn't matter which system you got, there's a variety of different factors that go in. I wish I could give you a better answer, I just don't have it. All right, so now that we know a couple of different things, we know what a benefit category is, right? We also know that there are processing systems, and the processing systems have names as well. So what is B of A? B of A is a Part B service processed by the FIS processing system. So it's a B service submitted on a UB04 or the 837I institutional transactions for claims. That is what B of A is by definition. So someone asked me, does this affect Part C or Medicare Advantage? And no, it's not. Medicare Advantage is a separate set of rules. Literally under the Social Security Act, it has its own separate section, which is why things function differently, have different things. What happens is with that, it's a separate set of it's a separate way in which they require claims to be submitted. It's all separate private contractors. I work for what is called traditional Medicare, which would be A and B. And I work for the Medicare administrative contractor, and we process claims. So let's move on to that next. So the Medicare administrative contractor who processes claims processes both Part A and B claims, and we do use both systems. This means we do have access to both systems. The durable medical equipment Medicare administrative contractor, they also process claims, but their claims are specific to durable medical equipment codes, and they are defined. They use the MCS. Remember, that was that one that is the 1500 or the the 1500 or the 837P electronic transaction. Now, unlike that, there's home health and hospice Medicare administrative contractor. They process health services and hospice services, both service categories. And I'll explain that in just a moment. Using the FIS system, or that UB04/837I system. Some people said, and one of the questions that came in is, a Part B benefit is home services. And then what's the difference between a home service and a home health service? A home service is something simply done in the patient's home. It is not under a home health plan of care. Key thing, plan of care. Once that plan of care enters, it then moves to the home health and hospice MAC, unlike your AB MAC. So that's where Part B, that system that we talked about with MCS, would process those. Now, home service can also be done on an outpatient hospital basis, so they could also be then submitted to Part A, and then they would be B of A. So they would be submitted to FIS, but it's still going to be that B benefit. Hopefully that makes sense to everybody. Okay. A couple of other questions came in, and one of the big ones is eligibility, and what happens if someone doesn't have eligibility, and how does that affect this? So first, keep in mind, eligibility is based Part A for inpatient care. It does not cover Part B services. Now, there are some that it could, and we'll talk about that, and it would depend on the type of eligibility they have. Home health is an example, right? That would be an example of one that could be covered, even though it's a B service. Okay. So inpatient coverage of a Part B otherwise covered service, that's what we're looking for when they do not have Part A. Question, how would someone not have Part A? And this answer is simply the number of quarters that they've worked in their lifetime, their spouse has worked, or someone else that could be eligible under doesn't meet the Medicare requirement, or they chose not to purchase it. So remember, to have Part A for free, you have to have worked 40 quarters, quote, 10 years. If you have not done that, then you will not be free. You do have the option to pay for it, and there's two different levels of payment. One is 29 and under quarters that you've worked, and one is 30 and up to 39, just below that 40 mark. This is all determined under the eligibility system for the Social Security Administration. We don't actually determine this, they do that. They can also use the Railroad Retirement Board. So this card right here would be the Social Security Administration. And you know that because there's no Railroad Retirement Board down in this red factoring portion of the card. If people have that premium, sometimes they choose not to take Part A because of the high premiums, and they become very expensive, especially if you are at the 1/4 to 29 quarters. It's a lot more expensive. Now, Part B is something that is always a premium-based coverage, and Part B is the service benefit category. So remember, it does cover certain things, and it can be inpatient care when they don't have Part A. So yeah, we will actually cover under Part B. It will not cover the inpatient care though. What it covers is services that they would otherwise be eligible for if they were not inpatient. That's where B of A comes in again. So the category would be there. So they have to have Part B for B of A to be effective. Otherwise, it's simply Part A. Home health, hospice. Again, here's that home health not under a plan of care. That makes sense, and hopefully it does to everybody. So again, you have to remember that. So let's talk about this in a little bit more if we have any more questions, which is actually just going to come up on the next slide. So before I'm going to handle any questions that came in chat, I do want to run through some questions that were pre-submitted. And the reason that I'm going to do that is because it makes it a little bit easier for you guys to have your opportunity to put them in chat for me. Okay, so go ahead and throw those questions right in chat. The first pre-submitted question relating to the benefit categories is, does nursing care fall under a professional service or an institutional service? And it can fall under both, and it really depends on the type of nurse. So while it's always considered professional service, sometimes the institution is paid because it's part of the requirement for them to be part of it, in which case it would fall under the Part A inpatient status. And I can give you an example. A registered nurse's service would always be part of the inpatient care and is not payable separately unless there are certain other criteria, and they're called Incident 2. We're not going to go through all the Incident 2 criteria. So when we talk about a nursing service, we also then have to recognize that certain other types of nurses can enroll separately because of their training, and Medicare recognizes them separately, such as a registered nurse and a certified registered nurse and an anesthetist. They have their own category, so they do not need to enroll at all. So it's a little different. The next question that came up was the cost or percentage of costs and how to apply it. Okay, this one was a little different for me because I wasn't really sure what you're talking about. When we talk about the benefit category Part B, you will always either have a 20% cost share the patient has to pay or nothing. Now, remember, this is after the Part B annual deductible applies, then it's the 20% cost share or nothing. What types of services don't have cost shares? Preventive care. They don't have anything. So we would pay after deductible up to 100%. So it really depends. Now, some preventive services and what Medicare really define as a preventive service, these would not even apply to deductible and we would pay them at 100%. So you can see the benefit category isn't quite as easy to say, oh, it's always 20%. Oh, it's always this after this. It really depends on the individual service you're doing. So I wasn't really sure where you were going with that. If you need more information, I'd really appreciate it if you could throw that back into chat so I can help you a little bit, okay? With that said, Leanne, do we have any questions in the chat?
We do, Tom. We have a couple. The first one is asking if you can repeat how to qualify for free Part A again.
Oh, sure. So free Part A, what you want to know is, first, it is measured in quarters. This means that someone in the Social Security Act, the Social Security Department, or the Railroad Retirement Board says you've worked 1/4 in your lifetime or you've worked 40 quarters, okay? So that's how it's measured in, again, payable taxes and all those different things they use to measure that. And so when you start with 1/4, you become eligible. Now this is premium Part A. You go up until 29 quarters, and that's the highest level premium. Then there is a lower level premium, and that starts at 30 and goes to 39. Once you reach 40 quarters in a lifetime, it is free because you've paid enough money. That's already considered your premiums paid for the rest of your life. So This is actually not determined by us as your Medicare administrative contractor. We follow whatever is set forth by the Railroad Retirement Board or the Social Security Administration. Keep in mind, we don't actually process railroad claims. If they say they're eligible underneath that, we send it to another contractor, so another Medicare administrative contractor. So when we look at that, that's how you get it. 40 quarters, one lifetime. Please note, I did not say consecutive. There's nothing consecutive about it. It could be 40 quarters over 50 years. That's fine. It's really about working that number of quarters, and then are they reported to the Social Security Administration, and can they track that? Hopefully that answers your questions. Anything else?
We have one more. When a patient is in a skilled nursing facility and they have had an office fee or office visit professional fee, does the nursing home get charged for that?
This is a very good one. And the answer is kind of dependent a little bit about the benefit category. So when you look at the skilled nursing facility, and didn't delve really far into this yet, but this will be more to come on later events. But skilled nursing facilities, Medicare Part A, inpatient care is only covered for the first 100 days. So when we look at that, if you go to an office visit, that professional service may be separately billable because it is a professional service. Now, what it's going to do is look at that and say, is it something that has a technical component, such as an X-ray, where you have a lab or where you have a reading, and then you have the technical taking? That part would need to be out, even though it's done in an office and there is a professional component to it. It's also going to look at things like, is it straight up an E&M, evaluation and management service? But then we're going to wind up in some coding issues, and I don't want to get into all of that. So does the nursing home automatically get that charge? And the answer is not automatically. You need to check the service, check the files available on the CMS website to be able to determine that. I'm going to show you right now what you want to look at on the CMS website. Okay, so Center for Medicare and Medicaid Services website. When you come in for Medicare, you will open the term Medicare. You're going to go to coding and billing. So on the left side, the fourth item down, coding and billing. Then move into the far right row and go to skilled nursing facility. When that happens, this is where you're going to see these different files available on the left side, and these are what are going to be procedure code driven. We have a whole lot of classes on this. There's a lot more that goes with that. So a lot of different factors that play into that. I don't want to get, again, too off topic on that because I could teach a whole, actually it took me 8 hours to get through just that category alone. So we'll stop there. Leanne, any other questions?
We have one additional question that's come in. Is there such a thing as emergency application to Medicare?
Okay, I'm going to try to get some clarification here. I'm going to assume you mean like emergency, maybe provider enrollment application. What are you talking about with application? Because I can't really answer that question without knowing that. If you're talking about emergency room stuff, that is a Part B outpatient benefit paid under the FIS system. So it's a B of A benefit. So if you could help me out and really understand when you say emergency application, what are we talking about, and where are you going with that, so that I can get you a better answer. And Leanne, did they respond at all?
They have not yet, but I'll keep an eye out for that.
Okay, so there'll be another opportunity for questions. So I just want to make sure I'm making you aware that in the meantime, I'm going to go ahead and move forward, and we'll keep going through the information you need to know. So a lot of people ask us, what are the systems that are affected? It's not just about like, what do I do with this, or why is this important? What do I have to know this? It's what systems are affected. So let's talk a little bit about those systems. The first one that is affected is our website. And on our website, we say Part A and Part B all the time. This is not how our website is broken up. Our website is actually broken up not by the benefit category, but the processing system. So Part A really means FIS processing system. And what did we learn about the FIS processing system? It contains both Part A and B benefit information. So every once in a while, someone will come into what they call the Part B because they're thinking benefit category, and they'll code a claim based on this information that's in this section, and it won't get paid. We'll send it back and be like, this isn't right, because what they're really doing is coding a UB04 or an 837I, and those are processed in the FIS system. We then further break it down because we have multiple functions within these two. The J5 FIS is J5A. The J8 FIS is J8A. The J5 MCS is J5B, and the J8 MCS is J8B. Let's take a look at that so that you have a better understanding. Okay, let's take a look at it. So again, we're going to leave CMS and we're going to go to the WPS. So when we come in on WPS, we have our basic topic centers. If you move through any of these, they are universal. However, the information is not always universal underneath them. One of the great things is the training center is truly universal. It doesn't matter. But you then see we have our jurisdiction. J5, as the slide stated, was Iowa, Kansas, Missouri, Nebraska, national providers. So there's a separate category for that. Those are our Part J5s. Okay. Now, this is again submitted on a UB04 or an 837I. J5B is actually Iowa, Kansas, Missouri, and Nebraska providers submitting on the CMS 1500 claim form or 837P. So when we say something like Part B denials, you really do have to make sure you're aware of which set of denials are we talking about. Are we going with these set of denials or this set of denials? So read the description. It's key because you may be hearing all about a set of denials that doesn't affect you, even though it's a benefit category of B. It may really only affect that. Same thing, Indiana and Michigan is J8, so you use the processing system to follow A or B. And I'll show you an example of how that works. We come into the training center. If we scroll and we open our live events page, now you could do this in Encore also, but we'll see this Part B, anesthesiology and common rejections. Well, what does that mean? Is it a benefit category or a processing system? If I select the link, now I have to read the description. And it's open. And you'll see this information, this webinar is common rejections on 05. We will focus on data from. So this one is MCS data. This would not be systems, FIS systems data, even though it's Part B benefit category. Anesthesiology may go into both of them. We're really going to look at this specific set of data. So hopefully that kind of helps you understand a little bit about the Part A and the B and how that affects our website. That also then sometimes gets people because on the Part A system, so the FIS system, physical intermediate shared system, there's things like revenue codes. There's things like occurrence codes and span codes, except they're not on the Part B, the 1500 claim form. So they're like, well, wait, I don't understand that terminology and it's telling me to do this, but I don't even have that. Or it's telling me I shouldn't do this, but I don't know what that means. You're probably in the wrong section of our website. So take a look at the claim form that you submitted and make sure you follow that correct section and that you're attending that correct training. So that's how that can affect you. Now this is a little bit different for the secure portal section, and this is why it's a separate slide, which is actually just the next slide. And this is right here, this is that login area. Now inside the login area, everything will function as one. Once you log in, you can have access to both A and B processing systems. In other words, you can have access to the physical intermediate standard or shared system, FIS, and you can have access to MCS at the same time. It's just based on the provider number. Eligibility is universal. It's going to give you both Part A and Part B. It's not anything with that. It's actually a HIPAA electronic standard transaction called HETS, HIPAA eligibility standard transaction HETS. And this comes from CMS. The Medicare beneficiary identifier lookup tool, same thing. It's a standard transaction, appeals, financial center, and letters. These are all basic information, okay? However, what is not the same, what does function differently is the claims processing area or some of the transactional areas. So when you look at it, it does have two separate system accesses. It's going to be the same thing, but you can go look at a Part A or a Part B claim. What does that mean? You can go look at a UB04 claim, 837I, or you can go look at an MCS 1500 claim. They'll both be in the same location, but it'll display differently. And so some of them look different because the claims are submitted. The clerical error reopening or SIR feature is for MCS claims, Part B MCS claims. It's not for Part A claims. It's also not for Part B FIS claims, only for MCS. So we want to make you aware of that. Prior authorization is done by type of service you're asking for. Hospital outpatient is done, and that is still going to be a B of A service. Remember the key thing I said was outpatient, that makes it B. However, it's going to still go through that. Now, on the other hand, you can do ambulance supplier services, which are only done for the 1500 claims. And again, that would just be a straight B service. So hopefully all of that makes sense and why this secure section of the portal can be used in certain manners. Now, unfortunately, I can't actually show you the information, and so it does have some limitations. If you do want to learn how to use this, the best way to start is to use the portal user manual, download and see the different items you can do. Again, I said start because it's an optional starting point. I do really like it and would encourage you to go out and check out our YouTube channel. We have a lot of recordings about this as well that may help you out, and to attend different live events where we talk about what you'll find related to the information that's there. One of the questions that was relating to the Part B of A regarding our portal is how long does it take for a claim submission, claim type, and development to occur so that the claim loads into the system? In other words, how long does it take for that inpatient claim to get into the Medicare portal and then to actually be viewable? And the answer is very interesting with this one. If it's your claim for your hospital, it can take up to 5 days from the time we receive it in the mailroom. That's a paper claim, so it can take a little bit. Also, it may never make it if it's an electronic claim and it fails the scrubbing software on the front end. That's a separate software and it's not actually going to make it to the processing system. If you're looking for a process claim or when it's processed, then it has to go through the full system, has to come in, and then it has to go through a variety of things like development, submission, all those different time frames. So just to say, when is it in the system is hard for me to answer. Again, if you're a facility looking, it's usually right after you submit it. Give it about a week, it'll show up. If it passes all the stuff. If it doesn't, then you've got to go back and check your electronic records. If you're not a facility and you're looking at it in a different manner, such as, is it going to be a Part B of A claim? Is it going to be a B claim? What are we going to do with this? In other words, are they a patient or not? That is going to happen after the fact, but we do have to wait for those to come in. So I don't really have a good time frame. I can't say 30 days, 60 days, 90 days. I can't say any of that because it is a claim-based system. All right. Next slide for y'all is the IVR. So the IVR is the interactive voice response system. This is that telephone system. We're doing some education on this later in the month. The interactive voice response system is something that is available to you, but it is very specific to how you bill in terms of the processing systems. When we say Part A IVR, you can see the operating guide. I want you to note that this IVR does contain Part B services because it's the 1500 claim form, UB04 claim form, 837I. So if you're talking about the Part B IVR, then you're talking about claim forms submitted on the 1500 or 837P. To put it into a processing system perspective, the Part A IVR works with FIS, the Part B IVR works with MCS. So when you go to access the information, you have to make sure that you're accessing the right section of the IVR. Otherwise, you're not going to find anything, and that becomes very hard. Okay. A universal transaction is an electronic transaction, and this is an eligibility transaction. And CMS does have one eligibility transaction that will give you all of Part A and B information. Now, you can get access to this transaction from CMS directly, and there's information right here on this. If you click on it, it's going to open the CMS website. It's going to tell you all about how to get access to it. You can also access this system and the other two that I just mentioned, which would be the IVR and also our portal. This is the actual transaction we use to get that information. It is a CMS requirement. So again, want to make sure you do that. You will hear the term 270. It's the eligibility inquiry, while 271 is the eligibility response. These occur very quickly from the CMS files, unless of course they're doing updates. Sometimes we'll let you know that, so you will want to check about that. But this is a universal transaction that contains both Part A and B information. The last system we want to talk about is direct data entry. This system is a way to access the FIS, the Physical Intermediary Standard System, or shared system sometimes it's called. This is always for someone that bills on a UB04 or 837I. That's it. So if you say, hey, I've heard of this great DDE thing and I can access the system from it, but I bill on a 1500 or I bill on an 837P, stop. It's not about you and you're not going to be able to access it. That's why on our website, when you look at information, we'll actually tell you. So if I was in the Part B section And right here on the top, I said, I want some DDE information. Awesome. It'll say, okay, here's all your different things. Awesome. I'm going to go to this overview one. What it is immediately going to tell me is this is not for you. This is for A only and B. Now, remember when we talked about A on the website, that was the claims processing FIS system, where B was the claims processing MCS system. So that's where you know that DDE is only available for FIS questions. So yes, you can get information out of it. You can definitely get eligibility information, claim status. You can correct claims. There's a lot of other things that you can do within this direct data entry system. But you have to make sure that you're using it with the right type of claim form. All right, let's move on. What's next? More questions. And again, I would like to give you guys the opportunity to put those questions back in there if you have them, but I'm also going to go ahead and go through some pre-submitted questions and remind you there's going to be a survey at the end. I'd really like you to take the survey, but we'll talk more about that later. Okay, so first question. I wasn't really sure where these two were going, so I'm going to talk about them. One just says reimbursement question mark. Now, Medicare reimbursement is a very complex item. There is not one fee schedule or reimbursement methodology. A fee schedule is one method of reimbursement. A fee schedule is a Part B method of reimbursement, a Part B benefit category method. However, it's not the only one. There's also prospective payment systems, inpatient and outpatient. There is one for critical access hospital. That's a reasonable cost fee schedule, our reasonable cost fee payment methodology. So I really wasn't sure what you were looking for with that. When we're talking about B of A, it really still depends on the facility type, the hospital billing it, that type of thing. But remember, it's always going to be a Part B service. I got some basic questions like, how do I bill for this service? Not sure what service you're billing for, and I'm not sure what you're trying to do with it. So I can't answer that because again, you need certain pieces of information, but I have to have a lot more. The next question is about the the hospital outpatient department prior authorization process. I'm not going to read the question. I'm just going to say they want some basic details on it. Okay, it is a Part B of A prior authorization for the hospital outpatient department. Let me show you where you're going to find those details. So first thing you're going to do, make sure that you are in the Part A parts of this. Remember, this is a FIS. When we go to that, we're going to open up the Topic Center and we're going to come directly to medical review. Now, medical review does the prior authorizations. This is pre-payment medical review. And then you look prior authorizations for hospital outpatient departments. So if we go through, when we click on that, we can find out exactly what we have to know about it. So it's for a hospital outpatient department on a bill type 13X. Again, here you go, that 1500, that 837P, you're like, what is a bill type? I don't even know what that is. That's because this is a B of A service, B of A hospital outpatient. Here's the services. You can learn more about the individual procedure codes and a variety of other pieces of information. I'm not going to belabor all of this and go through all of that because I'm not really sure what you wanted other than the basic information that I just gave you. One of the other questions is, who is primary when commercial is also carried? This really isn't a B of A related question. This is really about Medicare secondary payer, and it's way more complex. We have a 9-part series or a 10-part series on Medicare secondary payer, so I really don't want to get into it. What I do want to remind you is that when you look at Topic Center and you look at claims information, there is some Medicare secondary payer information available to you. Scroll down a little bit. You can see it's right here. We also, on our YouTube channel, and I'm going to go ahead and go to YouTube right away, and we have a playlist for Medicare secondary payer. So I want to give you this resource without going super in depth into it, because it's just not what this course is designed to cover. And by the way, when you talk about Medicare secondary payer, the claims are billed differently. And so because of that, view the full playlist that these are under. So this one's got provider enrollment information. I should probably bring up secondary versus Medicare. It'll help you a little bit. But when we do that, it's really going to be more, again, systeming. So you look at the encores, and when you look at this encore playlist, you'll want to check out the 2 different systems. And again, do you bill in a 1500? Then you want MCS. Do you bill on an 837P MCS? or do you bill UBO 437I? So hopefully that helps you out a little bit. Okay, Leanne, do we have any questions?
We do have one question. Is there a place here, either in CMS or WPS's website, to find out about claims denial reason code 34963?
All right, best place to do that, and I don't know if this will be one in there, I'm going to guess it is, but is to go to tools. Now, I will tell you there's a quick link, quick link for articles there, but if we go to tools, go to all tools down here in the bottom. And in all tools, you get just a lot of different tools. You can then look up the tool lookup, which is going to be the reasonary mark code. I know it's not really what you're looking for is reasonary mark code, but it will also give you what you're talking about. And this is your denial reason code, so you can see that. So first, I'm just going to go ahead and set that. I'm going to put that in. And this is how I always like to start, get a little bit more information so it doesn't have that. Okay, so now we know it's not in the code lookup. I would recommend that you email us with this and just ask us to put some more information in the code lookup tool. This code lookup tool doesn't have every code in it. It's really what people have asked for. We can do a general search on our website and we find out erroneously assigned to Medicare provider enrollments. Okay, so then what are we looking for here? And then you can look up these different items. Let's just pick the bottom one. It'll say outpatient therapy when the attending physician. So it just talks about how this happens with the record. So there's just a variety of pieces of information that are out there. I'm not really sure what you were looking for that or if that helps or not. Hopefully it does. Again, very limited information, but we do give you a couple of different resources. And one of the contractors is working with CMS. So if you wonder why then refers you to another contractor, this article is the one that's working with CMS to get all the options together. So that's why we're referring you to them. So they're setting up some different options for it. And that's why they're the ones that have that article published versus us publishing the same article. And then that's why we do that. So hopefully that makes sense. Leanne, any other questions?
We have no other questions in the chat.
All right, let's talk about a few more things that'll definitely affect you. First thing, I want to remind everybody that when we talk about these ones, these are actual ways to get answers and questions related, and that's where these questions are coming from. So first, customer service. Customer service is not based in a benefit category. It is based in a processing system. So if you say I'm going to call Part A customer service, or I need to get through that, what you're actually doing is looking at claims that are billed on that 1450, UBO4, or the 837I. Those are the claims that you're looking at. These go to the FIS processing system, regardless of the benefit category. Part B, on the other hand, is only those 1500 claims or 837P, and these go to the MCS. Here's another typo right here on the bottom of this. Questions relating to FIS claims, cross that off. MCS claims. I apologize for that being in a couple of different places there. It is my fault for not catching that earlier. FIS, MCS. So when we look at calling customer service, you want to make sure you're calling the right area and selecting the right options. Do not select based on your benefit category. You want to select based on your processing system. This leads to frustration from people when they do have to call back. We can't redirect them. And then we actually do get some negative things, but that also goes for the IVR. All right. When we look at claims, a lot of people say, well, where are my filing instructions? And the key thing to remember is that when you look at the general information about EDI, electronic claim submission softwares, this is what we're looking at. One of the things I did put up here is paper claims and how to get the general exceptions. This was something that was asked, and are those exceptions specific to one type of claim form? And the answer is no. The exceptions are about the 1500 and the UB04 both. So that's why I put it on the slide. Hopefully it'll help you out. I don't want to read through all the exceptions, however. I will let you know that each set of paper claim filing instructions are available on the CMS website, in the Medicare Claims Processing Manual. One is Chapter 25 and one is Chapter 26. This is the specific requirements that CMS has us as the Medicare Administrative Contractor use to process your claim. So it's pretty important to make sure you're following that, okay? So those hopefully will answer those two questions. If you have more about claim submission, let's go ahead and get those done a little bit later. Next, bundling. This is where we talked about the skilled nursing facility being responsible for certain things. So bundling does occur, and there's a variety of different forms of bundling. And this is to answer the question about inpatient bundling. So these are could be what would be a Part B benefit. However, the patient is in an inpatient Part A stay. So we did a Part B service. However, because the patient's status is inpatient, then the hospital has to bill that. Even though it's a B service, I understand that. Now keep in mind, there are certain professional services that are never part of the inpatient bundle. Why? Well, they're a professional service, and by definition, Part A doesn't cover them. So we want to make sure we're aware of that. The consolidated billing is the one that I showed you about those files. So it's related to the other question that we had. But again, it's when the skilled nursing facility is responsible for paying and when they're in the Part A stay. And then there's the National Correct Coding Initiative edits. This is the one that really is affected by B and by A. So what that means, or I should not say by B and A, what I should say is affected by processing systems. The National Correct Coding Initiative edits are broken into two sets of edits. One is the professional service and the ambulatory surgery center. That's the MCS processing system. The other one is the outpatient code editor, which is the FIS processing system. So when we look at that, when you're looking at it, they're both B, but B of A is the FIS processing system edits. Makes sense too. And then there are also only inpatient surgical codes. In other words, the patient must be inpatient, and so these are only payable to a facility that can provide inpatient care. So an ambulatory surgery wouldn't be impacted by that. Hopefully all of that makes sense. Another area that is highly affected that I would really recommend or take an opportunity to look at is the modifier section. Some modifiers are not applicable or act differently depending on the processing system you're in. So when you're looking at the modifier section, make sure that you are in the right section of our website. It's very important, okay? Just make sure you're doing that. The last one is policies. And so when you look at policies, even though it's for a Part B service, you do want to check to make sure if it has revenue codes in it, because that would indicate it's an outpatient. Okay, revenue code indicates outpatient. Could also indicate a type of service or type of bill. Type of bill indicates outpatient hospital. So facility, B of A. So anytime you're using a revenue code, we're always doing B of A. This is different than Part B processed by MCS because B of A is always FIS. So these are just some different things to kind of help tie you into that categories and those items that you might want to know. All right. We've gotten through all of our questions that we have pre-submitted. Leanne, did we get any more?
We did not.
Okay, so I'm going to go ahead and go through a few slides. I'll check again at the end. Here we go. First, we are having a National Provider Enrollment PE conference. This is not in your slide deck, but just I wanted you to be aware of it. We're not hosting it. It's actually going to be hosted by CMS and Noridian. And they're hosting this conference. It is an in-person conference, but it's free of charge. It's in San Diego, and it's on August 28th and 29th. The times do vary by day, so check that out. We did provide, there's information for you if you want. You can check out the description and registration. This information will be available as well on our website coming out in the e-news. So we just don't have this updated quite yet, but it is available to you. So if you're interested, take a look at that just until next week, the end of next week, to get this information on our website for you. And we're working on that right now. I say the end of next week because that's when our update should be done by. All right, so along with that, I mentioned this survey earlier, but I'm going to plug it again. Please take this survey. Help us understand what you liked, what you didn't like. Just take a few minutes. It's not a very long survey. It's not going to take you a lot of time, but it really helps me. Give me your good, your bad, and your ugly. Here's your good. What did you like? What did I do well? Here's your bad. What could I do better? What could I help you with? What would have helped you understand better? And here's your ugly. Did you like my PowerPoint? If you didn't like my PowerPoint, tell me why. Help me understand those visuals, okay? Please don't tell me that you don't like the look of the WPS or CMS website. I can't control that, so I don't have anything to go there. But so good, bad, and ugly, always give me that. Just take a few minutes. One other thing I want to encourage you to do, add comments on here. Tell me, one, why you're giving me a score that you are, but also what do you want for future education? Really important there, okay? questions come in, so we want to address our proof of attendance. This will come directly after the event. If you do not have this by tomorrow, email us. Emails on the next slide, and that'll be just a moment. Here's what's going to happen. This is an automated email. It's going to come out and say, take the survey. So again, I've already given you a QR code. I've already given you a link in the chat. I'm going to go ahead and give you another opportunity when I close out. Are y'all getting, I really want this survey? Okay, along with that, we're going to put it on this closing. The thing is, open it up and look at the bottom of it. This is your certificate. It has your contact hours, and these contact hours are what are needed for continuing education units. So we don't offer a separate certificate. This email works with that, and then you have to work with your governing body to get those, okay? All right. So if you have a question, if you have a concern, and it comes up in the next 7 days, take the opportunity to submit these. This is going to go to part B. This is going to go to the email address, same email address. If for some reason you don't get your certificate, whatever, the next day or so, and you're going to put part B of a webinar, this just indicates it should come to me in the end so we can get you help there. And then this is when we want it by. Now remember I said next 7 days. So just that's what we're looking at here. Now this was shortened from 10. So ignore the 26 and we're going to go with 7. Why did I shorten it, or why did we shorten it? Because we typically have all of these in within 2 days. So by the end of this, we typically will have all these in. So we just thought, well, okay, we'll shorten it to 7, make it a little easier on everybody to remember that date frame. Also, as a reminder, send claim-specific questions to customer service. All right. Here is our last slide. Again, I want to offer anyone the opportunity to ask a question. Any questions, Leanne?
We have no questions in the chat, Tom.
All right, thank you. So thanks everybody for attending and listening. We do encourage you, again, provide that feedback. It becomes really important. Remember, we want to know the good, the bad, and the ugly. We want to know all those things you would like us to see and improve on, and also those suggestions. Do take an opportunity to review our live events page to register for different events. Remember, later in the year, we're going to do some other new to Medicare stuff, which may help you out even further. Take an opportunity to check out our encores. On behalf of myself, Leanne, and all of Provider Outreach Education, I want to thank you for participating. I look forward to your surveys and your comments, and I want to see what I can do better and to help you in the future. So thanks for joining us. You may now disconnect.